Liposuction is a medical method where the surgeon is able to remove fat from certain parts of the body to give the body a nicer shape. There are multiple methods for liposuction. Some methods are safer than the others. All methods are trying to be gentle on the body, but some are more gentle than others. In my clinic in Dallas, we are trying to practice the methods that we believe are safer than others and provide better skin tightening. We rely mostly on ultrasound-assisted liposuction, which is the VASER, and on laser-assisted liposuction, which is the Smartlipo. When a patient comes to our office to have liposuction, that means that the patient has been prepared already for the procedure, had all the explanations, and we make sure that the patient understands the procedure very well. Then, when the patient comes on the day of the procedure, the patient took already antibiotics. As they come to the office, we give them some other pills which help provide sedation. There are people who don't want to be sedated, so we don't give them those extra pills. We start an IV, an intravenous line, to give them fluids and medications during the procedure. If needed, we will add medications to the intravenous line to provide additional sedation during the procedure. But we do not like to perform the procedure under general anesthetic. And there is a difference between general anesthetic and local anesthetic with sedation. It is safer to perform the procedure under local anesthetic, even with sedation. So we mark the patient, take some pictures, take some photos, bring the patient to the operating room, prep. We call it surgical prep, which means that we wash the patient with special type of antiseptic substances. We put the patient on the operative table, make sure that the patient is comfortable, make sure the patient is warm, cover the patient with sterile drapes, prepare the case, start by injecting local anesthetic. My technique is based on local anesthetic, as I said, with or without sedation. Once the area where the surgery is going to be performed is numbed, we go in and start melting the fat. The two methods that I use, the ultrasound-assisted liposuction, which is the VASER, and the laser-assisted liposuction, which is the Smartlipo, both of them melt fat. And it is important to melt fat first. That decreases the risk of liposuction in general. It is gentler on the body than traditional liposuction. And once we melt the fat, we then are able to suction out melted fat rather than tearing pieces of fat from the target area out, which is done with traditional liposuction. We then tighten the skin, and once we finish tightening the skin and suctioning, we take out all the instruments. The incisions are tiny. We put dressing on, put a garment on, and send the patient to a recovery room, where the patient will stay there and rest after the procedure with a family member or somebody who will accompany the patient all the time until they are able to be discharged. And that's it. That's the end of the procedure. If you are trying to reach me, you are invited to look up at the website all of the information plus the before and after picture, which many times are really amazing. You can call our number 972-661-8884. When you come for the initial consultation, it's completely free. Our practice is covering the whole Dallas-Fort Worth area. We see patients from Dallas, from the neighboring cities. The practice itself is in Plano. It is conveniently located in the middle of the whole metroplex.